Tonight on 60 Minutes, Tyler Bogardus returns for a special follow-up interview where he'll be giving further insight on his travels to Cambodia and Vietnam. Stay tuned for this exciting interview. Welcome back to 60 Minutes, where I'm now joined by Tyler Bogardus. Welcome, Tyler.
Hi, thanks for having me back.
I appreciate you coming back on the show today. Now, last time you discussed some of the effects of the Yali Falls Dam in Vietnam had on Cambodia's public health, correct? And this time you're going to go more into some of the other effects the dam has had on the people. What are some of these effects that you've seen?
Right, not only has the Yali Falls Dam construction impacted the public health of the people in Cambodia, but those public health effects have actually had a direct impact on the economy. With so many public health problems, the malaria, arsenic poisoning, things we discussed last time, this has decreased the productivity of the workers in Cambodia. This in turn has led to decreased income for the businesses and the people in that area. And without income, they haven't had any money to save. So therefore, they can't really invest anything into their businesses to create new capital and new facilities and new things that they need in order to expand their business, which has really just halted any economic growth in the region. Without investing in your business and creating new capital, there's really no way for you to expand production and to grow your business in any meaningful way.
Right. Now, what sort of health care do the Cambodians have?
There's really three sectors of healthcare in Cambodia. There's the traditional sector, which is what we think of as the kind of folk medicine, healers, different things like that. There's the public sector, which is basically run by the government and paid for by the government. And then there's the private sector, which is run by private individuals and corporations and is paid for at the point of service by the patients that are using the services.
Okay, and what would you say is the most commonly used sector, and what are the connections between these different sectors of healthcare?
All the sectors are really closely related, and really most people in Cambodia use a combination of all three sectors. I think it's very rare that you would find a case where an individual uses exclusively one sector. The public sector is still probably the biggest, just because it's the cheapest for families. Like I said, in the public sector, they don't pay anything at the point of service. Mm-hmm. It's mainly paid for by the government. The private sector, though, is really growing at a very fast rate. It's actually growing so fast that they're having trouble with regulation and enforcing the regulation. So there's some inconsistencies among different institutions within the private sector. But they are kind of working to correct that, although they do still have a long ways to go. And the private sector is also viewed as more expensive, like I said, because the patients have to pay for it at the time that they receive the treatment. Although, when you actually look at the amount of money that's spent on the care of patients in the public and private sector, the public sector costs about $75 per inpatient visit, whereas in the private sector, it's only $65 per inpatient stay. So, although it costs the individuals more in the private sector, it's actually overall cheaper to provide the services in the private sector.
That's very interesting. So with this negative public health being caused by the dam, would you say there's an additional stress on the healthcare sector now down there?
Yeah, I mean, I really think the way that the dam has affected the environment in Cambodia, like I said earlier, the people in Cambodia rely very heavily on the river and the flow of the water for pretty much everything in their daily lives. They're very dependent on it. So, the public health and the negative environment that has been created by the river by the construction of the dam has really caused a lot of additional stress on the healthcare system as, all these new malaria, cholera, different diseases like that are becoming more and more common.
And so then you could really tie this all together with the negative effects of the environment due to the dam has caused these negative public health issues, and it's really hindered the economic development in the area of Cambodia.
Right. I mean, everything is really very closely related. It starts with the dam being built and the negative effects that has on the environment. and the effects on the environment in turn cause the effects on public health. So with the negative public health, that not only does it decrease directly the economic development in the area because people aren't able to work, but the negative economic development also has an impact on public health since people are less able to afford healthcare treatment.
And what needs to be done to help prevent maybe this issue? If I mean more dams are going to be produced, what are they going to do?
Right. I mean, there's a big push to build more dams in this area. Like I said earlier, they have a very desperate need to produce more power in order to fuel the growth that's going on in countries like Vietnam. So dam construction is something that I really can't see coming to an end anytime soon. I think really what the healthcare sector needs to do is focus more on prevention and early treatment of these diseases. If you can catch them earlier and focus on more prevention and educating the people before it becomes a bigger public health problem, then I think you can start to end a lot of the negative effects that public health has had on the economy.
Well, Tyler, I appreciate you coming on the show again. It's always a pleasure.
Thanks for having me.